Now a story on wellness and a push for food to do the healing. It's Friday, and at one local hospital, that means it's time to fill the prescriptions for cardiac and internal medicine patients. As Paula Tutman shows us, this is not the typical pharmacy, but perhaps maybe it should be.
So, of course, there's a lot of talk about ways to fill prescriptions, but this is a different kind of prescription, and this is a prescription.
This is a poblano pepper.
What looks like a trip to an indoor farmer's market is a trip to an indoor farmer's market, but look a little closer and listen in.
And you're like, what's going on? Like, you just, blood rushes.
In this particular venue, fruits and vegetables are actually being prescribed by physicians. It's called the Fresh Prescription Program, and it is a deliberate doctor-initiated program in the Henry Ford Health System hospital system. It's simple. A physician in the group will actually write a prescription for a patient.
So pre-diabetics, anyone with high blood pressure, anyone who's looking to lose weight, even people who are full-blown diabetics at this point, all of this diet and nutrition education works really well for them.
Which sets into motion a series of events. Counseling with a dietitian.
So we're doing all the cooking, okay?
Yes.
So how do we include more vegetables in cooking?
Now these top parts you're going to want to cook real well.
Education by a professional chef to teach healthy cooking methods and to introduce patients to things they may not have ever thought to try before in the produce section.
My goodness.
I know.
I want a bag of those.
Yup.
For 6 sessions, the patient is given a $15 gift card to offset the price of produce in several places around town. And the patient is taught to help and heal themselves through proper eating. So Beverly is hoping not to join the family club of diabetics.
I'm overweight, and I know that. But everybody in my family is this size. So I'm trying to get a better hand on eating more fruits and vegetables. I don't eat fruits and vegetables every day, and I didn't know I needed to do that every day.
Joyce is a heart transplant recipient, and she has been a fresh prescription patient for 3 years.
My blood pressure is good. My everything in my system, my kidneys are good. Everything, my heart is good. It's great. And I'm just feeling healthy. I feel healthy and I feel better. And people see me, you look great, you look healthy, because they saw me when I wasn't.
Some people who have high blood pressure can bring down their medications, and sometimes people who are diabetic, as they lose weight, can come off of their medications or at least decrease their medications if they don't come off of it altogether.
These are good.
Winter is coming. There won't always be farmers markets, but these patients are being given the tools they need to keep their prescription regimen going so that by spring, their health story is a good health story.
That's heart healthy.
Paula Tutman, Local 4.
Patients in the Henry Ford Health System can find out if they are eligible for the Fresh Prescription Program by checking with their network physicians.